My name is Nirmal. I am the CEO of Preventify. We run clinics which manage chronic care and diabetes for smaller town India. When we started scaling our chronic care program, we thought the biggest problem would be to get patients. It wasn't. The real problem was to keep track of them. When we went beyond 1,000 patients, things started breaking. We did not have systems. Some data was in paper. Some data was in people's phones, which really meant that on a given day, we could not know whether our patients were doing okay or not. That was a big problem. We were managing chronic care, and the whole point is to look at data in a longitudinal way. We need to know how the patient was earlier and how are they now. What are the diet plans that we have given? What is the prescriptions that we have given? What is the lifestyle advice that we have given? All that, we needed to see that in one place. We operate in smaller towns where people are more at risk because of these, because they have lower awareness of these kinds of problems and the importance of looking at longitudinal data, which really meant that without systems, we were essentially flying blind. Patients did not know what was important for them, whether their medications were working. We were finding it difficult to track it. These are patients who actually needed someone watching over them as guardians. We knew that we had to build something. We did not have tools which we could use, which were directly available. We needed to build something. We sat together, we thought through what are the real features that we require, what do we require. Like basically this was a multi-user, multi-role kind of a platform, real data and real system. We are really working with people, real patients and real doctors, looking at people and their health. We couldn't be building this on simple Excel sheets and more, right? We had to actually have systems which would not break when we scale. So we tried with some of the most popular whiteboarding platforms which are available. We could see very shiny screens, very beautiful user interface, etc. But the real problem is at the moment we started using that properly, put a backend with data and a database, etc., things would fail. We could not really make this work just using a existing whiteboarding kind of a tool. So this is when we found Qwikbuild. With them, the good thing was that our vision of what we wanted transformed into a real tool. Here, we did not have a tech team, and we were starting to create a real tool for ourselves, which we could modify according to the features that we require. It's not just about the speed at which we created it. We don't need this in 2 minutes, right? We actually needed this possibly in a day. But we had real user flows where our coordinators, doctors, and admin could actually log in real data, real patient data, and create user flows which were very seamless. At the same time, when we were stuck, their dev assist feature, where we could get help from some of the human engineers, help us solve simple bugs, which would ensure that things worked well and did not really get stuck with some small bug which we couldn't solve because of AI. After this, our care coordinators could actually log in real patient data, lab parameters and more, see what was happening and guide patients in terms of adherence and compliance to the plans. And which also meant this was guiding our doctors. Our doctors were making informed choices with all the data that was available for the patients, lab parameters, diet, exercise, and all their compliance. They could use that data in a very visual form to make choices and decisions in terms of medications and more. This really transformed what we were trying to do. This just meant that care coordinators could pick up any of the patients, their diet plans, their compliance, their progress in terms of their journey with diabetes and other chronic diseases. We could see that without calling 5 people or referring to 5 different Excel sheets which somebody would have maintained. Today, we are not just managing thousands of patients, right? We are essentially building infrastructure which is required for maybe 10,000s or lakhs of patients. And all that in smaller towns where this kind of infrastructure barely exists. We never thought that it could be as fast as what we saw now. And that's what happens when you use a tool which is actually built for production and not just for a demo. So we are building real infrastructure using Qwikbuild.